Okay, Chair lays out House Bill 2187. The Chair lays out a complete House substitute, committee substitute for House Bill 2187. Chair recognizes Representative Howard to explain the bill.
Thank you, Mr. Chairman and members. You have a substitute. Yes, thank you, laid out.
Yes.
In 2009, then Senator Nelson and I passed Senate Bill 476 and created Chapter 257 and Chapter 258 of the Health and Safety Code. 257 is on nurse staffing. 258 is mandatory overtime prohibited. These two chapters work together to define nurse staffing laws in Texas. When we passed that law, we included legislative findings that remain relevant today. First, we found that research supports the conclusion that adequate nurse staffing is directly related to positive patient outcomes and nurse satisfaction with the practice environment, and that nurse satisfaction with the practice environment is in large measure determined by providing an adequate level of nurse staffing based on research and based on patient intensity. And further, that nurse satisfaction and patient safety can be adversely affected when nurses work excessive hours. Finally, we found, unsurprisingly, that hospitals and nurses share a mutual interest in patient safety initiatives that create a healthy environment for nurses and appropriate care for patients. This was the basis for the creation of these two subchapters. The reason we're focused on this again is because the law worked well until the COVID-19 pandemic. As you all know, the pandemic put intense and immense stress on every aspect of our society and was felt most acutely by our healthcare workforce. When the governor announced his emergency declaration, the prohibitions against mandatory overtime requirements that nurses enjoyed between 2009 and 2020 were lifted. This exception remained in effect basically for over 3 years, until the governor's final emergency declaration renewal expired in June of 2023. Despite the end of the emergency declaration, a survey conducted by the Texas Nurses Association of their membership revealed that staffing continues to be the #1 issue that nurses identify as contributing to burnout and their cause for leaving the profession. Anecdotally, we've been told by nurses across the state that staffing expectations have really never gone back to normal. Furthermore, nurses have reported that the implementation of the staffing committee process has suffered and is used inconsistently. An additional challenge is that while the compliance reporting is made to the Department of State Health Services, the actual regulation of hospitals is conducted by the Health and Human Services Commission, and there's no current mechanism for sharing the data between the two agencies. Therefore, any nurse that has concerns about the operation of the Nurse Staffing Committee is forced to report their employer to the regulatory agency, HHSC, before any review can be conducted, rather than accessing the DSH's report, the current way that it's set up. Anyway, so HB 2187, this is so confusing to me that would even be a problem, but anyway, clarifies the law, increases transparency, and ensures HHSC has the authority to act if the law is being violated. This bill has been negotiated between the Hospital Association and the Nurses Association. The committee sub for this bill simply cleans up the language to ensure that both parties were agreeable to the bill. The substitute requires DSHs to develop a mandatory reporting, which is actually attested to by the Chief Nursing Officer, and data exchange process between HHSC and DSHs. It also prohibits retaliation against a nurse who provides information to their nurse staffing committee or who reports violations of the law. Further, the committee sub requires HHSC to create an improved complaint process so nurses can report violations of Chapter 257 or Chapter 258 of the Health and Safety Code and receive a meaningful response to their complaint from the agency. Finally, House Bill 2187 will empower HHSC to impose corrective action plans and administrative penalties on a hospital that violates Chapter 257 or 258. HB 2187 may not solve the nursing staffing crisis in our state, but by strengthening the enforcement of the nurse staffing laws, which is currently non-existent. The enforcement is non-existent. It will improve the safety and working conditions in hospitals, which in the end is in the best interests of both the nurses and their patients, and also, of course, of the hospitals. At this time, I'll take any questions and reserve the right to close.
Okay, thank you. Members, Representative Schofield.
Hi, Representative Howard.
Yes.
Normally, when someone's fighting against mandatory overtime, it's usually the union that wants you to hire more rather than work the ones you've got longer. But we don't have that here. We don't have the possibility. We've got a nursing shortage like we can't believe. I know in my district, the University of Houston created a nursing program out in my district, and literally the 3 gigantic hospitals near it eat all the nurses. I mean, whatever you put out, they hire them. We still haven't added any. What is our, I mean, I understand what you're trying to get with this bill, but
Yeah.
what's our long-term solution? We can't just say, don't work them longer, because that just means there's no nurse on staff.
Right.
How do we get more into the profession and get them to stay?
There are multiple bills being filed this session that are the result of the governor's task force on healthcare workforce shortages that came out of the coordinating board. I have several of those. Other members have other bills too. Some have come before y'all. Some are going before higher education. This is not a one-size-fits-all solution, for sure. We're looking at how we improve the pipeline, but also what this bill is addressing is how do we retain the nurses that we have. So having the nurses be involved in the decisions about the nurse staffing ratios, nurses need to be a part of what administration is choosing to do. It doesn't mean that they get to dictate what's going to happen. That's not what this bill does, and that's not what currently exists. But they are a part of it, and their recommendations should be considered by the administration. And clearly, the administration wants to retain their nursing staff too. So this is really something that everybody wants. It's just how do we put it together here? But to your point, yeah, it's a challenge right now. There's no question about it. And the nurses understand it's a challenge, but they also have to be able to work and not be burned out to the extent that they don't feel they can give the appropriate ethical care to their patients that they've been trained to do. And also, just at some point, get burned out so much that they can't even go back in there. So it's really trying to find that happy place right now, knowing that there are a lot of factors involved. This is just one of many things that we're trying to address this session to take care of the nursing shortage situation that we have.
In the short term, what do we do? Obviously, we have a mandatory overtime bar where you're trying to make it more enforceable. But again, if I can't use the 18 nurses I have longer than I do, I'm going to get to the point where I can't staff shifts. What is the short term? What are we hoping they will come up with as an answer to that?
And there are some resource witnesses here, someone from the Nursing Association here that I think can address that more clearly than I can, if you don't mind waiting for that. Thank you.
Members, other questions? Oh, Representative Frank.
Just briefly, I assume this issue is more in the bigger city hospitals where you have that. I guess I just wonder if in some of the smaller, we've been talking about rural hospitals, whether or not there needs to be quite this much not overhead related to it, but additional paperwork. And if y'all looked at that, whether this is going to create more kind of basically more regulation than we've talked about
Right,
on the smaller.
and I know that's an issue for you, of course. And,
Well,
and you
yeah,
bring,
not
no,
really
you
for-
bring it
yeah.
up a lot, and I think that we need to be looking at that sort of
Yeah.
thing. I don't know.
Which is
that
pretty easy to coordinate
Well,
if there's 15 or 20 nurses
yeah.
as opposed to.
And I don't know if they've looked at a difference in that. I
Yeah.
can't tell you that. Again, you'd have to ask the resource witnesses about that. But this is not anything that is. The enforcement of this is the enforcement to ensure that they have the committees, that they're making efforts to address these situations. It's not an enforcement that says you have to have X number of nurses or you're going to be punished.
Okay.
This is to get around having any kind of a particular mandate. It's based on what's going to be best for the care of the patient.
Right.
And that's going to vary from place to place as to how that's determined. So the reporting, again, you have to ask the expert witnesses here, but my understanding is that it's a pretty simple process of reporting. It's self-reporting, It's just checking some boxes, basically. And the problem has been, though, that they send in the information, they report it, but nothing's ever done or looked at because it's being sent to the non-regulatory agency.
Got it.
This is just going to get it going to the right agency.
Okay, thank you very much.
Thank you.
Thank you, members. Other questions? Okay, thank you, Representative
Thank
Howard.
you.
We'll reserve your right to close.
Thank you.
Okay, the chair calls Lori Forbus. Okay, I have you registered as Lori Forbus. You are testifying on behalf of the Texas Nurses Association, and you are for House Bill 2187. Is that correct?
That's correct.
Thank you.
Yes, thank you. Chair Van Dever and committee members, thank you for allowing me the opportunity to come and speak today. My name is Lori Forbus. I'm a registered nurse with Texas Nurses Association in support of the bill. I have over 24 years of experience in both at the bedside and in leadership. As a nurse, that makes me inherently a patient advocate, and secondary to that, I'm a nurse advocate. Hospital-based nurses are the largest single workforce in healthcare. We are the front line of healthcare. Our actions directly influence safety, outcomes, and the overall experience of the people that we serve. When nurses are supported, patients are safer, outcomes improve, and hospitals perform better. The Texas Health and Safety Code 257 recognized this back in 2019 by requiring hospitals to have a nurse staffing committee. But 16 years and a pandemic later, many of the committees have fallen by the wayside. At my mid-sized hospital in West Texas, our staffing committee all but dissolved during COVID-19. When we resumed, we were non-compliant with the law, and frankly, no one really cared or seemed to be concerned about it or even knew about it. But our chief nursing officer did care about it, and with his support, we rebuilt the committee in the right way by the letter of the law, and in less than a year, our staffing committee has seen real change. We've updated staffing policies, increased engagement from bedside nurses, and measurable improvements in falls with injury, hospital-acquired pressure ulcers, and responsiveness to patients' needs. These are all not just statistics, but they all have a life, a family, and a person at the end of that outcome. The state of Texas has
Ms. Forbus,
invested.
can you wrap up?
Sorry.
please?
The state of Texas has invested in solving the nursing shortage by increasing the funding for nursing education, and we're really grateful. But recruitment alone is not enough. Nurses need to come into the profession and stay, otherwise those investments are lost. So I urge you to be in support of 2187, and thank you so much for your time.
Thank you for your testimony. Members, any questions? Thank you. Thank you for being here. Chair calls Dollye Martinez. I show you registered as Dollye Martinez. You are testifying on behalf of the Texas Nurses Association, and you are for House Bill 2187. Is that correct?
Yes, sir.
Thank you. Proceed.
Chair Van Dever and committee members, thank you for your time today. It is an honor for me to be here in support of the profession that I love and I'm very passionate about. My name is Dollye Martinez. I've been an RN for about 6 years. I'm here on behalf of the Texas Nurses Association, and I'm supportive of the House Bill 2187. As we continue to see progression post-pandemic, it is imperative that we support and empower the nurses who remained at bedside. We've developed a staffing ratio that are crucial for both patient safety and the well-being of healthcare professionals. When we are adequately staffed, we are able to closely monitor each patient, administer treatments on time, reduce medication errors, communicate effectively, respond quickly to an emergency. House Bill 2187 requires healthcare facilities to establish and maintain safe staffing plans to ensure quality care. My responsibility as a direct care nurse is to speak up and to request that all facilities be held accountable. We would like 100% compliance to the law. My facility that I work for has established and maintained a nursing staff advisory committee, and it's thriving. We meet monthly and we discuss all aspects of staffing, including staff well-being and retention, nurse burnout and turnover, public trust, safe patient ratios. We, as the committee, have just reviewed our staffing plan, and we've made recommendations together for changes that were brought in front of the governing board for approval. Our committee encourages and allows for the bedside nurse's voice to be heard, both concerns and requests that current staffing plan reflect the real-time needs of the patients and the hospital environment. This committee was once just a monthly checkbox, but now we are seeing a positive impact on our work environment, leading to more effective and compassionate healthcare system as a whole. Everyone from the bedside to the boardroom and everyone in between has a responsibility to establish and to maintain adequate staffing. Your constituents deserve the best and safest care possible. Please vote yes to this bill. I am a direct care nurse, and this directly impacts me and my work daily. This is what Texas nurses want and need. Thank you for your time.
Members, questions? Representative Pearson.
Thank you, Chairman. Thank you for your testimony, Ms. Martinez. My question is centered around preventing the retaliation against nurses. Would you mind just sharing with the committee what retaliation against nurses looks like?
Well, I've never experienced it from the board member or from other nurses. I mean, we do experience violence from patients, of course, but never like that. So we do have a policy in place that prevents any kind of like backlash, of anything like that. We're open to any suggestions, and we really take their request into consideration.
Okay, thank you. I was just curious because
Yeah.
the bill also prohibits retaliation against nurses who provide the information. I just didn't know what retaliation against nurses would look like.
I really don't know. I can't speak to that because
Okay.
I've never experienced that
Thank you.
or even seen it.
Thank you, members. Thank you for your testimony.
Thank you so much.
Chair calls Serena Bumpus. Have you registered as Serena Bumpus? You're with Texas Nurses Association and yourself, and you are for House Bill 2187. Is that correct?
Yes, sir, that's correct.
Thank you. You may proceed.
Well, thank you, Chair Van Dever and members of the committee. My name is Serena Bumpus, and I am a proud Texas registered nurse of 23 years, and I also serve as the CEO of the Texas Nurses Association. And rather than go through my whole speech here, I think it's important to answer some of the questions that were brought up. The mandatory overtime prohibition, Representative Schofield, that isn't saying that the hospitals can't offer overtime. They just can't mandate that a nurse work it. We work a lot of overtime voluntarily, but it's not something that we want to force onto anyone because they may have childcare issues. They may be a single parent, and that makes it very difficult for some nurses to fulfill that obligation. In relation to retaliation, we get phone calls from nurses all the time in our offices where they have reported unsafe conditions. In Texas, we have a law called Safe Harbor, and nurses are able to invoke Safe Harbor when they feel like their patient assignment is unsafe or what they're being asked to do violates their duty to the patient. And in many instances, we hear reports from these nurses that they've been terminated as a result. They've been demoted from their positions, or they've just been left off the schedule altogether. And so that's the type of retaliation that can occur and that we want to avoid. We know there's a current shortage of about 44,000 nurses here in the state today. The current average years of experience of a nurse right now is 2.8. It was 6 prior to COVID. So nurses between the ages of 25 and 44 are leaving faster leaving the profession faster than those who are age 65 and older. So we're losing nurses at both ends of the spectrum. One just due to retiring out because of the age, but the others are leaving because they aren't going to put up with the conditions that they're working in. And staffing is one way to resolve those issues and to retain the nurses that we have in the profession. A Texas Center for Nursing Workforce Studies report shows that we currently have experienced about a 23.2% turnover rate here in the state of nurses, and that we have a 16.4% vacancy rate in the state. So we have a lot of opportunity, and this is one solution to ensuring that we're able to retain our nurses in the state. And I'm open to any
Thank you.
questions.
Members, any questions? We do have questions. Representative Schofield.
I appreciate your testimony, and as you pointed out, we're basically 44,000 nurses short. And I think you said the vacancy rate, which I had never heard before, was 16.4%. And obviously, you don't want to make it worse by burning out the ones you've got, but also if you cap how much they can work, you leave yourself with more vacancy. And as what I was asking Ms. Howard earlier was, how do we fix that so that people want to stay? And I think you've alighted on the fact they're leaving early. Do we know where they're going? Like, what job do they prefer to this?
So bedside nursing is hard in the hospital. It is very hard. And, you know, the beauty of being a nurse is that we have a lot of options in places we can go. There are needs all over the state, all across the spectrum of healthcare, and so many of them will move into a clinic space. There are remote, telemedicine jobs that nurses will go into. Some of them go back to school to be advanced practitioners. There are a lot of different opportunities that nurses can do to help contribute to the overall healthcare system.
So we think they're staying in, like when teachers leave, we
They
let the
leave.
discipline get bad in classroom, they leave teaching.
Yes.
You think the nurses are probably staying in healthcare, just maybe not in the hardest jobs.
Correct.
Thank you.
Representative Jones.
Thank you for coming to testify. You definitely have given me information that I need to know. So, of course, I'm concerned that the average, I guess, work experience time for nurses is 2.8 years.
Yes.
When it used to be 6 years, and I sort of liken that to, I'm a better lawyer at 6 years than I was at 2.8.
I was a
years.
better nurse than
Right, because you just have experienced more things, and you probably know how to deal with stuff better.
Right.
Even though there's staffing shortages, I would imagine, and you can correct me if I'm wrong, that if you're making nurses who are doing the hardest jobs, if you're forcing them to work overtime, they're either going to do it begrudgingly, which I don't think I want a nurse with a bad attitude at my bedside, or a nurse who doesn't want to be there. Right. So that's why you're trying to deal with the mandatory overtime. So you want optional overtime, not mandatory overtime, and you can't be retaliated against if you say I can't do it.
Correct. And the prohibition on mandatory overtime is in the current statute. That's Chapter 258. It just isn't always necessarily adhered to.
So is there something in the bill that allows you to, I guess you report that they're making you do it. So that's what's new?
The reporting mechanism would be something that would be new, yes.
Okay. And I would also imagine, I don't know. So when people are mandatorily doing overtime, do you know if they're like doing it a lot or little? Because I think of like truck drivers who drive too long, and next thing you know, they having an accident because they're tired. Right? Do you have that happening with nurses?
We do. During the pandemic, I can tell you we had nurses who reported working upwards of 100 hours, which is
in a week?
Yes, which is concerning. We still have nurses who work anywhere from 50 to 60 hours a week at the bedside, which is a lot when you're on your feet for 12 hours a day.
I just want to make sure I heard you right. Normally, you have a 40-hour work week, like for
36
some
to
jobs,
40, yes.
36 to 40, and on a 2-week period, you work 60 to 40 hours. And you're telling me that some nurses are working 100 hours a week.
Well, 100 hours a pay period. I'm sorry.
pay
Let me
period.
clarify that.
Okay.
Yes.
I was
Sorry.
about to have a heart attack.
Yeah.
Okay, thank you.
You're welcome.
Members, Representative Simmons, I'm sorry.
Thank you, Mr. Chairman. Thank you for being here today. You may have mentioned this earlier and I missed it. Are we seeing similar pipeline issues in other states, or is this something that is kind of unique to Texas? And can you explain or share why?
We have pipeline issues all across the country. This is not unique to Texas. We are fortunate here in Texas, though, that we have this current staffing law that is to help support and empower nurses to have a voice in how they staff, in addition to some of the other protections like Safe Harbor. We're one of 2 states in the country that has that. So we are not unique in terms of the shortage. We are very unique in terms of the protections that we have in place for nurses and what we can do to help retain them in the state. You're welcome.
Okay, members, thank you for your testimony.
Thank you.
Okay, the chair calls Jack Frazee. I have you registered as Jack Frazee with the Texas Nurses Association, and you are for House Bill 2187. Is that correct?
That's correct.
Thank you.
Thank you, Chairman and committee members. I'm going to try and be very brief. I just want to try and answer some of the kind of legalistic questions that haven't been touched on yet. Part of what this bill is really going to help with is communicating with the agency so there can be some administrative oversight. Because when you don't have a responsive agency or ability to follow up on self-reporting of noncompliance, it leaves the nurse in a tough position. If you're reporting to the committee or to management or somebody that this law is not being followed or that you're being forced to work mandatory overtime and you don't have an agency to speak with about it and good procedures for that, what you're left with is boiling tensions, and if that ultimately turns into retaliation, then you basically have civil litigation as your only option, which is not efficient, and obviously you have to wait for something bad to happen before you can initiate that process. So this bill will help with all aspects of enforcement to keep us from getting to that problem, and it will also just boost the protections that nurses have currently. The benefit of that is then all these other things that the legislature is doing, like funding nursing education, means that we're not losing folks who are just tired of working in these conditions. So all of it works together. This bill is actually reflective of Recommendation 10 from the governor's task force on the healthcare workforce. So it is one of those task force bills. There's about a dozen that are floating around to address all kinds of aspects of the nursing pipeline. And I'm happy to come talk with any of y'all about how it works as a package.
Thank you, members. Okay, thank you for your testimony.
Thank you.